Well, there's a lot of steps along the path to becoming an adult. And so the key is to start early and for the youth to start taking charge of their health care. One consideration parents may do early is to find out from their pediatricians what age that provider will no longer see their young adult. Some practices stop at 18, some stop at 21, so it varies. And so, with that, it sets their expectation of how they need to proceed with making a plan to find an adult provider. Another thing a parent can start doing early on is building on the skill sets of their youth or young adult for life skills. These are things that are often overlooked these days because people are very busy. But we want to start empowering our youth and helping them have ownership, even around simple household tasks like making their bed or various simple tasks, household chores. And they can start to build on other areas of ownership. So this starts transferring to when they start having to take care of their own health, that they can start having that ownership. So, for example, we have some kids with medical care needs that may want to start early on, like 5 or 6, to learn how to swallow a pill, which might make their life much easier than taking 2 teaspoons of distasteful liquid medicine. And there are programs for that. We may not in healthcare promote this very well, but we're getting better. And for example, some other ways parents can promote this with their kids are that asking them, why do you think you have to take X medicine? How do you think it helps your body? You know, why do you think you go to the doctors? So start engaging them and involving them in the process of what they're doing with their health care. These steps help to create incremental understanding. Parents can also support their youth by having healthcare goals. They may say, gee, we're going to the doctors today. I want you to think of one question you want to ask that is important to you about your health. These are things that are kind of practical, but I think we are so busy on our lives every day that we may not really think about breaking things down like this to help them gain these skill sets. We as parents need to guide and support our kids to do these simple activities so they can gain confidence in how they navigate the healthcare system and also to eventually navigate their own healthcare.